Hello YouTube, Sir Dragon X here, coming to you once again from my beautiful town of San Miguel de Allende. Today, I'm going to continue my healthcare series with a bonus video about people who live here with Medicare. In the video coming up next. Welcome back to Retired Life in Mexico, No Bull. Not only will we present you with the facts, but we present you with the true reality. Today, I'm going to continue to focus on healthcare. When I started this series on healthcare in Mexico, I stated that Medicare does not cover healthcare in Mexico. That is true, but there are some limited options that do exist for those on Medicare. Actually, a viewer reached out to me and made me aware of these options. This viewer has even used one of these options to have surgery here in Mexico. Although limited, they may be a solution for you, and I felt it a disservice not to inform my viewers. As always, before we start, I want to remind you to subscribe to this channel and hit the little bell so you won't miss any of my future videos. I also encourage you to like this video if you enjoyed the content. It helps me get the word out on YouTube. And don't forget to visit us on social media at the links listed in the description of this video and on the banner of this channel. Oh, and guess what? We just started a website. We can be found at www.retiredlifeinmexiconobull.com. I want to remind everyone that I am by no means an expert. I do not have any personal experience with the Medicare system. So I am going to do this video based on research that I have done and with the help of viewers that live here with Medicare in Mexico. These viewers explained to me how they manage living in Mexico with Medicare. Now, if you live here on Medicare and see something in this video that I left out or isn't accurate, please feel free to leave a comment in the comment section below. It will be a great benefit to our viewers. I know I have covered healthcare options for foreigners here in Mexico, but truth is there may be some hurdles that you may face, especially if you are 64 years of age or older, or have pre-existing medical conditions. Here are just some of the hurdles you may face. According to our Mexican private healthcare insurance agent, you cannot obtain private healthcare insurance for the first time after the age of 64. Insurance premiums rise every year an average of 10% to adjust for inflation. But after the age of 54, this percentage begins to rise and can hit as high as 18 to 20% a year. Bottom line is that private healthcare insurance can get cost prohibitive for some. Although IMSS public healthcare insurance is an option for a minimal yearly premium, many people may not qualify due to pre-existing conditions. Some of these conditions can be as simple as high cholesterol or high blood pressure. Also, care can be very excellent or non-existent depending on where you live. Insabia is free, but as I stated, it does not cover all conditions, and you may be responsible for 40 to 60% of the cost of major treatment. Not to mention, if you need treatment for a major medical condition, you must travel to a major city. Also, due to shortages in staff, medical facilities, and supplies, you may not have access to decent medical care, even for minor medical conditions. Now, the big question is, where does that leave those Americans that want to move or travel in Mexico that are on Medicare? Well, as I said earlier, Medicare will not cover you in Mexico. Now, with that being said, you do have some options, although limited, which we will discuss. The information I will be discussing is on the Medicare website, and I will be leaving a link in the description of the video below. Before we start to discuss what options you have, we must discuss what Medicare will cover in a foreign country. Actual Medicare will only cover healthcare services in foreign hospitals in 3 situations. You're in the US when you have the medical emergency and the foreign hospital is closer than the nearest US hospital that can treat your illness or injury. Now note that your medical emergency or condition must have originated in the United States. Next, you're traveling through Canada without unreasonable delay by most direct route between Alaska and another state when the medical emergency occurs, and the Canadian hospital is closer than the nearest US hospital that can treat your illness or injury. Now, it's also important to note that Medicare determines this on a case-by-case basis. And lastly, you live in the United States and the foreign hospital is closer to your home than the nearest US hospital. There's also a catch. Medicare will only pay for covered services you get in a foreign hospital. So is that it? Actually, no. You can obtain two different types of supplemental insurance policies that will cover you when you are outside of the United States. These policies are primarily to cover what Medicare doesn't cover when you are in the US, but some do have foreign coverage. First, there is what is called a Medigap supplemental policy. Standard Medigap policies provide foreign travel emergency healthcare coverage. Now, Medigap policies cover foreign travel emergency care if it begins during the first 60 days of your trip. Medigap policies cover 80% of the bill charges for certain medically necessary emergency care outside the US after you meet a $250 deductible for the year. Foreign travel emergency cover with Medigap policies have a lifetime limit of $50,000. Now, where do I find these policies? In the links that I will be leaving in the description of this video, there is a tool that is based on your zip code. Now, the disadvantage is that it only covers you for 60 days after leaving the United States. The clock does reset anytime you return to the United States. So technically, you would have to return to the United States every 60 days to reset the clock. So this may not be convenient for you. This may be convenient though for people that live close to the border, but not those living in the interior of Mexico. Now, the second type of policy is called Medicare Advantage, which is the policy that my viewers use. Medicare Advantage is an HMO PPO type healthcare supplement policy. Some Medicare Advantage plans cover foreign emergencies on a reimbursable basis. There is no lifetime limit. There are no restrictions on how long you can be outside the United States. Now, with that being said, you have to have an official home of record in the United States. Now, there is a catch. You must return to your home of record in the United States every 6 months to validate your eligibility for coverage. Now, the disadvantages though are you are limited to a network of HMO or PPO doctors when seeking attention in the United States. You can also find these policies in the links that I provide in the description of this video. So, in a nutshell, these are your two basic options. These two basic options are the only two options that are sanctioned by Medicare. Now, I must mention one last service that was brought to my attention. Before I mention this service, quick disclaimer, I have no affiliation with this company. Now, this service was mentioned by several people on a Facebook group. Supposedly, it operates in Mexico like an HMO with a network of doctors, and they do take U.S. insurances, including Medicare, and process your claims. It claims to be free, and several foreigners have made comments that it works. Now, what was also mentioned, even though membership is free, there is a waiting list to join. Now, apparently, the disadvantage to this is that the doctors network only consists of certain areas of Mexico. This service is called Lakeside Medical Group, and I will leave a link in the description of the video below. Now, I do warn that if you use this service, you use this service at your own risk, since it is not sanctioned by Medicare as far as I know of. I know these options sound limited, but as I always say, where there's a will, there's a way. I have spoken to several people on Medicare living here in Mexico, and I have asked how they manage with Medicare. Some have indicated that since the cost of medical care here is affordable, that they pay out of pocket for minor treatment and travel back to the United States for any major medical procedures. Others that qualify for IMSS coverage, they actually use this in combination with their Medicare coverage. When they're here in New Mexico, they use IMSS. When they go back to the United States, they use Medicare. I've even spoke to others who invest in an emergency evacuation insurance in case of an emergency. Bottom line is, don't let your age or Medicare stop you from coming to live in Mexico. Like I said, where there's a will, there's a way. Until next time, see you soon.